Okay, so today I'm going to be performing the skill, performing a large volume cleansing enema for our patient. So before I even go into the room, I want to make sure I gather my supplies, which my supplies are going to be an enema bucket. I'm going to have my warm solution that is ordered from the provider to administer for the enema. I'm going to have my lubricating jelly. And if this was a soap suds enema, I would have my Castile soap. Okay. I need my waterproof pad to place below the patient prior to administering the enema. I have an extra towel just in case things get messy. And I have my bedpan for my patient. When deciding what commode you want to use for your patient, you want to make sure that you're assessing for their ambulation status. So if your patient's unable to get out of bed, then you're more than likely going to need a bedpan. But if your patient's able to get up out of bed to go to the restroom or go to the bedside commode, you want to make sure that you have those supplies as well as non-skid socks on the patient's feet. Okay? So I made sure that I have my supplies. I knock, knock, knock. All right. Hello. My name is Tyler. I'm going to be your nurse today. I'm going to be administering your enema. So before we even get started, I want to make sure that I verify your name and date of birth. Can you tell me your name and date of birth? Hector Ochoa, 1980. Perfect. All right, Mr. Ochoa. So have you ever had an enema before? Let's say that the patient hadn't. So what an enema is, I'm going to insert this tube with this solution that's ordered by the provider into your anus, into your rectal cavity, which is going to help stimulate your bowels to help you have a bowel movement. I understand that it's been a few days for you since you've had a bowel movement, and it's not going to be a painful process, but it's going to be a little bit uncomfortable, okay? All right. Okay, so I'm going to go ahead, wash my hands, don my gloves. And at any time, Mr. Ochoa, if you feel uncomfortable, if you have any questions, or you need me to just take a pause real quick, please let me know. I'd be happy to help you out. Okay. Putting on my gloves, I'm going to raise the bed to a working height. So with a large volume cleansing enema, you're going to want to place them in the Sims position. So it's going to be on their left side. So you want to make sure that you raise the bottom side rails on the left side of the bed. Okay. If you are needing assistance with moving the patient, then making sure that you have whoever's going to assist you with that present. Okay. So before I even get the patient on their side, I want to make sure that first I'm assessing their GI system. I'm assessing their bowel sounds. So I would auscultate with my stethoscope to make sure bowel sounds are heard. I would check for any abdominal distension with the patient if they're having any pain. I would also, when I roll the patient on their side, I would check for any fecal impact. Okay. I I want to make sure that I want to check for that before, as well as any contraindications that would prevent me from being able to perform the large volume cleansing enema. Okay, so I've assessed the GI system. Mr. Ochoa, when was the last time you had a bowel movement? Like we said earlier, about 5 to 6 days ago. Okay, so I've assessed all that. I am clear to go. So I'm going to go ahead and get my solution ready. The thing about the solution is you always want to make sure that you check the provider's orders to what's actually ordered for the patient. They have soap suds enema, they have Castile soap, they have um, medications that they can put into the enema. But for today, we're just going to do a soap suds enema. Okay, so I'm going to use my Castile soap. Okay, so when you get your enema bucket, no matter how it comes prepared, sometimes it comes with the tube disconnected. You want to make sure that you connect the tube to the bucket before you ever put water in there, or else water's going to go everywhere. Okay, the second thing you want to know is that you always want to go ahead and clamp that tubing before you put water in the bucket, because if you don't, you're going to have a huge mess on your hands before you even get the process started. Okay, so I have that clamped, I have it connected. So with my solution, I just have some warm water here. How I tested it to see if it was warm is I put it just on my wrist, okay? If it's too hot, we want to make sure that we're not administering that to the patient, or if it's too cold, that could also. Either way, too hot, too cold could actually cause a vagal stimulus. The patient could get dizzy and they could actually faint. So we want to make sure that this is warm to our wrist, not hot, not cold. Okay. So I'm going to go ahead. I'm going to pour my solution in my Enema canister. Okay. So typically you're going to do about 500 cc's to 1,000 cc's. Okay. So I have that. I would go ahead, open up my Castile soap, spray that in there. You'll notice it turns a different color and it's mixing itself right now. Okay. So while that is mixing, I'm going to go ahead and have my patient roll on their side. If they're unable to do it on their own, or if you need more assistance, make sure that you do get that assistance. Okay. So Mr. Ochoa, I'm just going to pull you my way a little bit and then roll you on your left side Sims position. Okay. What you want to make sure is that you have better access to the anal region. So you may have to put their left leg just like this and hyperextend their upper leg towards their chest as much as possible. Okay. That gives us the best route to be able to access the rectal region, the anal region. Okay. I'm going to place my waterproof pad below the patient. Okay. Mr. Ochoa, are you okay? Biggest thing is you're going to want to communicate with your patient very frequently during this process. Okay. So we see that my Castile soap enema has mixed. Okay, so that is ready. I have an extra towel on hand. I am now going to go ahead and lubricate my tubing. So I'm going to insert it about 3 to 4 inches. So I want to make sure it's at least lubricated 4 inches. Okay, tearing off the top, lubricating. Okay, this is a clean procedure. This is not a sterile procedure, but I want to make sure that it's lubricated well above where I'm supposed to go. Okay, so the biggest thing about an enema is the higher you have the buttocks, you're only supposed to have it about 18 inches above the anus. The higher you have it, the faster it flows into the patient. So if you have it too high, it's going to go really fast and it can cause a vagal stimulation with the patient. So you want to make sure that you start out just at hip level and then gradually increase or heighten the height of your canister. Okay, so I'm going to go ahead and set it right here. All right, Mr. Ochoa, I'm going to go ahead and I'm going to insert the tube. So if you see you have the anal region right here, you want to make sure you visualize it first. Okay, Mr. Ochoa, I'm going to go ahead and insert. If you can take a deep breath for me, okay? 1, 2, 3, insert. Okay, going about 4 inches, monitoring your patient as you go. Okay, so I've gone about 4 inches. Now I'm going to raise my canister, okay, just about hip height level, and I'm going to unclamp it. Okay, I'm not really going to unclamp it because I don't want water going into my mannequin, but I would unclamp it, and I would notice that the water was lowering as it was going, and I'm just gradually raising the height of it, but I don't want to go too high because then that would go way too fast for the patient, okay? So I have it just at hip level. I'm gradually increasing it. I'm monitoring my patient. Mr. Ochoa, are you doing okay? Yeah, if my patient started complaining of abdominal cramping or feeling dizzy, I would go ahead, I would clamp the tube, not removing it yet, but I would clamp the tube to make sure it stopped for just 15 to 30 seconds. After about 15 to 30 seconds, checking back in with the patient, are you okay? Can I go ahead and proceed? Yeah, okay, proceed, and then just gradually raising it up to about 18 inches above the anal region. Okay, so let's pretend that all the solution, or as much as the patient was able to tolerate, went in. I would go ahead and I would clamp the tube. I like to go ahead and have another towel right below, because sometimes what happens is when you take out the tube, some of the solution does come out. Okay, so I want to make sure I'm not standing directly behind it. I have it clamped. Okay, and I'm going to pull the tube. 1, 2, 3. Okay. All right. May have to wrap that in right there. Okay. It's important to have waterproof pad below the patient. Okay. Mr. Ochoa, are you doing okay? Yeah. So you're going to need to keep that enema solution in for about 30 minutes, okay? 15 to 30 minutes. But I'm going to lower your bed to the lowest point possible. I'm going to give you back your call light, your belongings in reach. I'm going to go ahead and leave this waterproof pad below you just in case. So I can go ahead and keep you on your left side if that is tolerable, okay? Providing for your privacy, okay? Raising the head of the rail, okay? Lowering the whole bed. Making sure, especially if you have an impulsive patient, you want to make sure that you have the bed alarm on if they are prone to getting up frequently. Because sometimes with these enemas, patients will feel a certain urgency after about 15 minutes to go to the bathroom really fast. So you want to make sure that you have that ready for them, okay? All right. If your patient just wants to lay back on their back, that's fine, but preferably we would have them on their left side for 15 to 30 minutes. Okay. So lowered the whole bed, sat them up a little higher for comfort. Okay. Making sure that you're giving them their call light and their belongings back within reach. Okay. Assessing for patient tolerance. You're assessing for any abnormalities that you notice during the procedure, and then checking back in with your patient after 15 to 30 minutes to see if they're able to have a bowel movement. Okay. And that's going to be a large volume cleansing enema.